So an interesting study came across my desk this morning. It was about the clinical effects of your MRI report and what effect it has on both you as a patient and me as a care provider and other people, physiotherapists, spine surgeons, all that type of stuff. So the study was published in March of this year in the European Spine Journal. Most of us have heard of the placebo effect, but how many of you have heard of the nocebo effect? So the nocebo effect is essentially the placebo effect in reverse. When we receive bad information, or not necessarily bad information, something that we interpret as negative, it can negatively affect our outcome as healthcare. This particular study was looking at people who have low back pain. Now, generally with low back pain, you are going to get better. Most people with low back pain get better in the long run. However, this particular study is interesting because they gave two sets of reports, and the people who received scarier sounding words, even though they meant exactly the same thing, they typically had worse pain scores, they typically did not recover as quickly, and also clinicians so recommended more invasive procedures, were less likely to recommend conservative care even though the people were likely to get better. Kind of the long and short of this particular study is that it's very important to remember you are most likely going to get better, in fact. The problem is when we get into the mental space of, oh, I have this thing going on in my back, look at this level of degeneration, or this disc bulge, or this annular tear, or whatever sounds scary to you, you then start to inhibit yourself mentally, and your pain scores are worse, your functionality scores are worse, the whole 9 yards. And we as clinicians, and I may be guilty of this as well, I look at the report, or the other care provider looks at the report and says, oh, look at all this degenerative change and all this damage that this person has. They're going to be in pain for a long time, or I need to do something dramatic to solve this. The reality of it is, if we just take careful steps and we do conservative approaches, most likely you're going to get better. The long and short of this is, remember, lots of it's in your mind. The placebo effect is real, the nocebo effect is real, and hopefully if we keep focused on our function, we are improving our function every day, we're trying our best to get better, and I'm trying my best to help you get better. With that partnership going on, there's a pretty good chance to get rid of your pain. You don't have to catastrophize and be worse than you really are, because that mental headspace really does affect you, and it really does decrease your recovery. Anyway, I hope you're all having a good day. I hope you found that little bit of information relevant and interesting to you. If you did, please leave a comment below and enjoy the rest of your day.